So typically with diabetes, I oftentimes get the question as far as what are the signs and symptoms. Commonly we're trained you get you get really thirsty. Sometimes you go to the bathroom a lot. Sometimes you lose or gain weight. But oftentimes you can have really bad or poorly controlled blood sugars and you don't have very noticeable symptoms. So once again, that's part of the routine physical. Oftentimes people ask, what dietary change should I make, or what is high in sugar? And oftentimes it's the stuff that tastes good. So it's your carbs, your pastas, your breads, your red meats, your sweeteners, that type of stuff, sugary drinks, and oftentimes we just have to be careful because we don't know we have diabetes and until we get checked. High blood sugars have multiple micro and macrovascular changes or effects, and oftentimes it is a stroke or a heart attack or end organ damage that creates these problems. Having a good glucose control is important because sometimes it's that stroke or heart attack, that's your first symptom. So another thing that's very common is chronic infections. I have a lot of diabetics that had chronic infections, and once we got their sugars controlled, their infections resolved. Having low blood sugars or hypoglycemia is also a risk. Believe it or not, having really low blood sugars can provoke strokes, can provoke heart attacks, and can make you ill. Some patients know oftentimes patients know when their sugar's low. They get a little shaky, a little nauseous, maybe a little dizzy. But we always have patients check their blood sugars, not just for high, but also for low blood sugars. So having your blood sugar well controlled is important, primarily through diet and exercise. So we recommend exercising, at least 150 minutes a week. The DASH diet is popular, but oftentimes we say it's a joint effort between the patient and the doctor. So, if you do have questions, ask your doctor what's the best way to control your sugars.